Today we will continue with the hygiene exam, and this is when I walk into the room. Now, as I walk into the room, I must have my green notes ready in regards to with the patient. I always start off on a personal note. I try to find something that they like to do. They might like house day football, hobbies, about their children. I spend about I say a minute talking with them on a personal note. And what I want to do is just have them relax a little bit before they sit in that chair. Because once again, people don't get up in the morning and say, boy, I get to go to the dentist today. So we like to just relax them and let them calm down a little bit. Then I'll turn to my hygienist and say, what's going on? And then the first thing that she tells me is about the patient's concern. And when she says that, I turn to the patient and I ask them, tell me a little bit about it. Why this is so important is you're telling the patient that you're hearing them, okay? And you're not just blowing them off. You're trying to build a relationship here and you understand their concern. And then I will go back to her and say, okay, what else is on? And we have usually a routine, and our routine is next would be to tell me about the medications, if they're on medications, if they added medications, if there's anything else that I need to know. Second, if she's taking blood pressure, what is the blood pressure? Is it normal, abnormal? Three, we talk about the little game we play with infected sites. And if the patient is under that number of 10, please congratulate the patient. Say, hey, listen, you're doing a fantastic job. Keep up the good work. You want them to feel good that they're taking care of their mouth. 4, we go over anything that she sees that I might have to look at in the mouth that might be a concern in the future, and I want to make sure that I spend extra attention there. And 5, she'll go over if she talked over treatment of, say, a crown on number 3, and she says, hey, Mary's ready to go at crown 3. You say, listen, Mary, that sounds great. We will get you scheduled and we'll move on. Stop there. Your hygienist has just done all the work for you in regards to treatment planning, and just move on. Now, if the patient says, I can't do that crown, then what I want to do is say, listen, let me look at it and let me see if I can put it off a little bit longer. And please tell them in layman's terms the pros and cons and maybe the consequences if they put it off. Then I start my exam. As I put the patient back, once again, the first place I look is the concern that they had. You look at it, you examine it, you say, yes, this area is going to need a little bit of attention, but let me complete my exam and then we'll come up with a treatment plan for them. Once again, what you're telling the patient is that you hear them. You're building a relationship, and the concern they came into, we will address. Building a relationship long term will help you with all your treatment plans. You will make life much easier for you. I'm going to stop here, and then the next time I want to talk about what I call overhear psychology that I use in my exams. Hang in there, and I'll see you next time.